Chikungunya. It's a name that's becoming increasingly familiar, and for good reason. This mosquito-borne viral disease is spreading rapidly, impacting communities across the globe. Once confined to specific regions, chikungunya is now a public health concern in over 100 countries. What makes chikungunya so concerning? It's not just the debilitating symptoms, which we'll delve into shortly. It's the potential for long-term health complications and the significant impact it can have on individuals, families, and healthcare systems. The good news? Knowledge is power. By understanding the virus, its transmission, and the ways to protect ourselves, we can effectively combat its spread and minimize its impact on our lives. This essay aims to equip you with the information you need to understand chikungunya, recognize its symptoms, and most importantly, take steps to protect yourself and your loved ones. Stay informed, stay vigilant, and together, let's fight back against this global health threat. Chikungunya virus. It might sound like a complicated medical term, but understanding its basics is simple. This virus, belonging to the alphavirus genus, is transmitted to humans through the bite of infected mosquitoes. Primarily, these are the Aedes aegypti and Aedes albopictus species, the same mosquitoes responsible for spreading dengue and Zika. The virus's history dates back to the 1950s, when it was first identified in Tanzania. The name chikungunya originates from the Makonde language, meaning that which bends up, a reference to the debilitating joint pain that characterizes the disease. Once confined to Africa and Asia, chikungunya has spread dramatically in recent decades. This spread is attributed to factors like globalization, increased travel, and unfortunately, climate change, which creates more favorable conditions for mosquito breeding. Understanding the virus and its transmission is the first step in protecting ourselves. By being aware of the risks, we can take proactive measures to prevent mosquito bites and limit the spread of this debilitating disease. Chikungunya infection typically manifests within 3 to 7 days after a mosquito bite. While some people might remain asymptomatic, most experience a range of symptoms, often starting abruptly. The hallmark of chikungunya is fever, often high and accompanied by chills. Adding to the discomfort is severe joint pain, particularly affecting the wrists, ankles, hands, and feet. This pain can be debilitating, making everyday activities difficult. Other common symptoms include headache, muscle pain, fatigue, nausea, and rash. The severity of symptoms can vary greatly. Some individuals experience mild, flu-like illness, while others suffer from severe joint pain and other complications that can linger for weeks, months, or even years. It's important to note that chikungunya symptoms can mimic other mosquito-borne illnesses like dengue and Zika. Therefore, seeking prompt medical attention is crucial for accurate diagnosis and appropriate management. Diagnosing chikungunya relies on clinical evaluation and laboratory testing. Your doctor will ask about symptoms, travel history, and mosquito exposure. A physical exam identifies symptoms like fever, joint swelling, and rash. Laboratory tests confirm the diagnosis. The most common test detects chikungunya virus antibodies. These antibodies are your body's defense against the virus. Additional tests like PCR may be recommended. These are helpful in early infection stages. Early diagnosis is crucial. It rules out other illnesses and aids timely symptom management. Section 5. Managing chikungunya, relief and recovery. There is no specific antiviral treatment for chikungunya. Management focuses on relieving symptoms and supporting recovery. Rest is crucial, especially during the initial phase. Adequate hydration is important to combat fever. Over-the-counter pain relievers can help manage fever and joint pain. Most people recover fully within a few weeks. Some experience persistent joint pain for months or years. Consult your doctor if symptoms persist. Prevention is key. protecting yourself and your community. Preventing chikungunya starts with understanding how it spreads. It spreads through the bite of infected Aedes mosquitoes. Protecting yourself from bites is key. Use EPA-registered insect repellents. Wear long-sleeve shirts and pants. Eliminate standing water. Support community mosquito control efforts. Together, we can reduce chikungunya. Section 7. The long road, potential complications and long-term effects. While most people recover fully from chikungunya, some individuals, especially older adults and those with underlying health conditions, may experience complications. One potential complication is persistent joint pain, also known as post-chikungunya arthritis. This condition can last for months or even years, significantly impacting mobility and quality of life. Other less common complications include neurological problems such as encephalitis, which is brain inflammation, and Guillain-Barré syndrome. There are also heart problems like myocarditis, which is heart muscle inflammation, and eye problems like uveitis, which is inflammation of the middle layer of the eye. In rare cases, chikungunya can be fatal, especially in individuals with weakened immune systems or other underlying health conditions. The long-term effects of chikungunya are still being studied. However, we know that persistent joint pain can lead to disability and reduced quality of life. It's essential to seek medical attention if you experience any lingering symptoms after recovering from the acute phase of the illness. Section 8. Chikungunya and travel. What you need to know. Planning a trip to a region where chikungunya is present. It's crucial to take extra precautions to protect yourself from mosquito bites. Before you travel, consult your doctor about necessary vaccinations and preventive medications. Check the CDC website for travel advisories and recommendations for your destination. Pack appropriate clothing, insect repellent, and mosquito nets if necessary. During your trip, stay in accommodations with air conditioning or window screens to keep mosquitoes out. Use mosquito nets while sleeping, especially if your room is not well screened. Apply insect repellent regularly, especially during daylight hours when mosquitoes are most active. Be aware of your surroundings and avoid areas with stagnant water, which can serve as mosquito breeding sites. If you develop fever, joint pain, or other symptoms of chikungunya during or after your trip, seek medical attention immediately. Inform your doctor about your recent travel history, as this will help them make an accurate diagnosis. Section 9. A shared responsibility, combating the chikungunya virus. Together. Combating the chikungunya virus is not just the responsibility of healthcare professionals or government agencies. It's a shared responsibility that requires collective action from individuals, communities, and nations. We can all contribute by raising awareness. Talk to your family and friends about chikungunya, its symptoms, and prevention strategies. Support research efforts aimed at developing effective vaccines and treatments for chikungunya. Advocate for public health measures. Support public health initiatives focused on mosquito control, disease surveillance, and community education. By working together, we can create a united front against chikungunya and reduce its impact on global health. Section 10. Stay informed, stay protected. Your health is in your hands. Chikungunya is a growing global health threat, but it's not an insurmountable one. By understanding the virus, recognizing its symptoms, and taking proactive steps to prevent mosquito bites, we can significantly reduce our risk of infection. Remember, prevention is key. Use insect repellent, wear protective clothing, eliminate mosquito breeding sites, and support mosquito control efforts in your community. If you experience any symptoms of chikungunya, seek prompt medical attention. Early diagnosis and symptom management are crucial for a speedy recovery. Stay informed, stay vigilant, and most importantly, take control of your health. Together, let's fight back against chikungunya and protect ourselves and our communities from this debilitating disease.